Hey there, peeps. Hope you're doing well, staying sane as we mostly stay indoors. I was just in my office, as you saw in my last recorded lecture, for the very last time for a while, packed it up and said goodbye to some colleagues. Everyone was kind of doing the same thing, and here we go. So you'll see a lot of this pretty orange chair that I love so much from Anthropology, my favorite home store. It's falling apart on the seat, though. I won't show you that part. That's what my kids have done to it. Anyways, here we go, talking about health policy today. So let me share my screen with you. We're gonna get started. So what I have done here is completely reworked my old PowerPoint on public health policy so that it can be COVID specific. So I have an assigned article that I'll mention here in this lecture, which is just fabulous. And I'll talk about that in more detail later. But then we're just gonna walk through this quickly. Basically, what I want you to know about public health policy. Obviously, this is something, as with other topics in this class, that we could spend an entire semester on, even more than that. And so I'm just gonna go over briefly what I want you to know and examples of what I want you to know. I want you to know the 4 ways that health policy can happen. There are 4 different ways. The first way is through legislation, where Congress passes some sort of bill, or sometimes that could come directly from the White House, from the president, kind of issuing an executive order or something like that. So that is one way that health policy can occur, is through bills and executive orders. Another way is through the budget. So through offering funds to different categories and departments and areas, that's a way that health policy can occur. Judicially is when health policy occurs through the court system, and when there's a case being debated and then the judge makes a final ruling on how that case should go, that can put health policy into place. And the final one is administrative or initiatives, kind of where a government, either federal, local, or state, kind of sets out that this is kind of their plan or their initiative or their directive. And I'm going to give examples of these. So I'll walk you through some examples at the federal level, state level, and then we'll talk about the local level, which is the county health department. So for us, an example of current legislation regarding COVID was the declaration or the proclamation that President Trump just made that we are in a national emergency. So this was issued a few days ago on March 13th. And basically, it's not that long. This is straight from the White House website, but it's basically saying that we are now in a federal emergency or a national emergency, and so different things are going to happen because of it. Let me get back to my slide. So basically, the main thing that comes out of this is that requirements associated with Medicare, Medicaid, CHIP, which is, if you remember, is the Children's Health Insurance Program, and HIPAA, which you all know well. There's some relaxation, if you will, going on with requirements with those. So basically, the goal being that more people will have access to the care that they need related to stopping this pandemic. With HIPAA, that's not exactly care, but my assumption with the relaxation there is that that's allowing for more collaboration across departments, whether it's health systems in connection with the CDC, FEMA, other federal agencies, kind of relaxing HIPAA rules so that we can share information as quickly as possible in order to prevent the spread from worsening, learn about treatments, etc. One specific example that I came across last night was that Medicare is now expanding their coverage for telemedicine. The link is here because when I was in on that county town hall last night, a lot of the healthcare providers were saying, what do we do with all of our non-urgent appointments into our clinics and our hospitals, our non-urgent surgeries? What are we supposed to do? Do we reschedule everything? Do we see them in the parking lot, which a lot of people are triaging in the parking lot and not allowing anyone to come into the lobby? What do we do? And so this is now allowing that Medicare will pay for more telehealth visits for non-urgent appointments. So now all of these clinics around San Diego are kind of scrambling to make sure that they have their telehealth capabilities set up and can do that appropriately for patients who do need chronic medicine management but don't have to be seen. I experienced this firsthand today This is not new to me, but I am in frequent contact with my son's diabetes nurse educator. He just got an insulin pump last week, and so there's a lot of new stuff going on. And I talked to her on the phone, which is how we normally communicate, but I asked her about getting tested for COVID in our family because my other son, Christian, has been sick all week and has had a pretty bad cough and congestion. I'm not overly concerned. However, Soren has diabetes. That's considered a very high risk population for this. So we were inquiring with Kaiser about getting tested. And we learned that even though Soren is a little bit, kind of considered high risk with diabetes, I learned from my diabetes nurse that actually they're not treating any pediatric case as high risk and needing testing unless they're extremely symptomatic or have major immunocompromised status. And she just also told me on the phone, you don't want to come into Kaiser right now. Everyone's in the parking lots getting screened and not being allowed in, and it's a crazy place. So don't come in. So anyways, that's just a helpful personal tidbit there. The next way, so that was legislative. The next way that policy can happen is on a budget level. So just a little quick bit on then and now, where we have hurt ourselves and where we are finally stepping in. 2 years ago, the current White House administration cut funding to the CDC by a significant amount so that they ended up cutting their pandemic prevention efforts by 80%. They had efforts focused in 49 countries. They took that down to 10. China was not in that 10, interestingly enough. And so we've had, some real issues, you might have heard of this already, with not being prepared for the pandemic, in part because we had no money to support these positions, these task forces that had been going on previously to 2018. Now we're feeling that pain. However, now we are putting more money in this area in what was just passed. I heard about it on the news this morning, the Families First Coronavirus Response Act was signed yesterday. And so this is actually the congressional report here, kind of the executive summary in it, if you're interested. But let me go back to my PowerPoint where I kind of listed the main things. So main things coming out of this is there is now money to help with paid family leave for people who are caring with people who have COVID or caring for their children home from school and they can't go to work. That's me. It's requiring employers to provide paid sick leave, which, as you can imagine, is really hard for small businesses, but this is hitting, people have to get paid when they can't be there. It's expanding food assistance and unemployment benefits, and also making sure that coronavirus testing is free for everybody in the country. So this is how we are expanding our budget to help with the pandemic. The other two ways, judicial and administrative, I'm going to give some examples in the state level. Actually, judicial, I haven't been able to find one yet, but what I did find instead was an excellent article. I have it at the bottom of the screen here. This is your assigned reading for health policy. It's a fabulous article from Health Affairs, which is a health policy journal, a very reputable one, and they have a fabulous article on the concept of health justice and what that means when we're talking about COVID. So they go through in detail all the different legal and policy standpoints that should be taken to help people, such as preventing evictions, freezing evictions right now, so letting people stay in their homes, such as providing more opportunities for safe sheltering for the homeless, as they are an exceptionally vulnerable population with COVID. So there's lots of different things listed there. I want you to read that article, not only because it provides a wide range of ideas on how to create policies for all people, and it specifically addresses different social determinants of health, but because it also talks about how to help the most vulnerable. And this will be something we will be revisiting on exam 2, because we will come back and look at vulnerable populations and how they are being affected by COVID. So that's my little hint for you. The other thing here is the fourth way that health policy can happen is through administrative decisions or initiatives. And so this example here at the state level, the state has offered several directives to us in California as to what we need to practice in regards to keeping the pandemic under control. So this is their COVID-19 web page here. It talks about what to do when you're sick, if you have symptoms, if you're a healthcare provider, how to protect yourself, who's at risk. Great information, And then towards the bottom, should public events be canceled? So it talks about their directives on closing bars and restaurants and no groups larger than 10 people. And it talks about what social distancing is and how to practice that. And should you wear a mask? Masks are not recommended for the general public at this time. And you may have already heard that PPE is in high demand for healthcare workers. So that is something that we are trying to encourage the public not to hoard, and make those available for the people who need it most in our hospitals. Okay. And then the last thing I want to touch on is what policy looks like at the county level. I've already offered in a previous PowerPoint and readings what the county is doing, how they're looking at COVID. There's not really any more specific guidelines on their website beyond what the state is recommending at this time. So instead, I want to just switch gears instead of talking about COVID here and talk about something that I really, really do want you to know about. And that is what is called the Community Health Needs Assessment, something done on a local, and for us that means county level, every 3 years. So essentially what this is a phenomenal comprehensive assessment of the community where all nonprofit hospitals come together and do this assessment. And they take a lot of time and efforts to do it. It's a collaborative thing in order to find out what the community needs. This requirement came about with the Affordable Care Act, and they have to do it every 3 years in order to maintain their status for CMS reimbursement. So that's for Medicare, Medicaid. So it's really important. They want to maintain that status, right? So this is the most current results. Dr. King and I just went to the briefing where they kind of shared their findings with all of our public healthcare providers. That was back in, I want to say January. It was a great meeting to be a part of. But this is this graph here, and I have a link to the actual executive summary shows what they consider to be the top 10 health needs. So if you can see, the top 6 are considered social determinants of health, and then the bottom 4 are our top health conditions. And then what I think is really cool, this is very different than 3 years ago, the 2016 one, is they put stigma on both sides because they are calling out that stigma related to all of these health conditions and social determinants, it can really be a huge barrier, perhaps the hugest barrier to seeking treatment, to preventing worsening, to seeking help, to working together. So something that you're probably aware of, stigma is a huge issue, especially when we look at things like homelessness and economic security and behavioral health. So my question to you here is, what do you think that our top health need or issue was in 2016? Because in 2016, they actually ranked them. So I'll just leave you for a second. Do you have any ideas what might have been the top health need of 2016? The answer is mental health. Oftentimes people say cardiovascular disease or obesity or diabetes, but mental health. They did not rank these this time, but I would guess that mental health, behavioral health continues to be at the top of the list of needs. What I find really interesting, there's the link there for the executive summary. This is the first time, and the county did call this out, they identified this as well, the first time that social determinants of health are actually listed in the health needs, and that it's not just medical conditions. They're finally recognizing and calling out that social determinants are what we need to focus on. We need to look at the root cause, right? And not just what are the diagnoses that people are coming back to the ER for over and over and over again. So I love that. All right, so that wraps up my incredibly short lecture on health policy, mostly as it relates to COVID. As you can imagine, this is just the beginning in a rabbit hole health policy. Something that I'm fascinated by. And if you're interested in health policy, man, just keep going with that, because we need more nurses creating policies, whether it be at a hospital level, whether it be advocating with a national nursing organization, whether that be running for state assembly or Congress. We need more nurses at the table helping make big decisions for our nation's health.